in the heart of Yorkshire.
Red Ford.
Hello, Barnsley A&E.
An unbeatable team.
1, 2, 3.
Hard at work 24 hours a day.
I feel like I'm on Titanic and bows just lifting up out at water.
7 days a week. Saving lives.
Hands up off your chest, Mary. We've got you,
Helping loved ones.
I'll have you looking beautiful again.
Didn't expect to be losing part of my body today.
Making the community they serve better.
I thought I'd do it up. Oh, you're okay.
All staff's been brilliant.
A health service treating anyone.
You'll need to see a doctor.
You'll find out that I'm an idiot.
And everyone. A team doing anything and everything for each other.
Sweetheart! Hey!
This is Barnsley Casualty 24/7.
The National Health Service might not be perfect, but thank God we've got it.
Another life saved.
On shift tonight, Sister Jane.
I'm a worker, not a shirker.
Emergency nurse practitioner Joe.
Do you think you'll tolerate a second one?
Easy.
Right, good.
And junior doctor Alice Duffy.
Your heart rate's going quite fast at the moment, so we need to have a look at that.
So get ready to share a shift.
Yeah, gonna give me a fist bump.
With the team at Barnsley Casualty.
Has anybody any idea what is happening within this department?
It's the start of another busy day at Barnsley Casualty.
Elmia, if I book a porter, do you mind taking cubicle 19 up to AMU? Just concentrate on getting these people out onto wheels. I'll shout for a porter. Porters!
For Sister Jane, it looks like more of the same after a tough shift yesterday.
I feel it's a little like deja vu. I've been here before.
But today, she's got another problem. Some nurses have phoned in sick.
So it was busy yesterday with 12 nurses on the shop floor, and now I'm -3 to look after a similar amount of patients. At the start of a shift, when you haven't got enough nurses on, it's very stressful. It's just juggling, really.
And to add to Sister Jane's pressure, the first emergency of the day is on its way in.
Hello, Barnsley A&E.
They're rushing in 21-year-old Harry, who paramedics think is showing signs of sepsis from an infection. Dr. Duffy and the team immediately do his observations.
Thank you. Sepsis is really, really dangerous because it can cause damage to all your organs in your body. If you don't get the right treatment quickly, you can die from it. My name's Alice, I'm one of the doctors. So tell me what's happened today and what's brought you into hospital.
Pretty much. I've had a lot of back pain. I've not been eating very well. I haven't been drinking very well. And then today I started shaking very aggressively.
Okay.
And I don't know what caused it, and if anything, it just really scared me.
Okay. On your obs that we've done here in Resus, you have got quite a high temperature, so that's potentially what caused you to have the shaking episode. Your heart rate's going quite fast at the moment, so we need to have a look at that.
Harry's high temperature, low blood pressure and fast heart rate are all signs of sepsis.
We need to pop a cannula in you, get you some antibiotics and things, take some bloods.
Dr. Duffy needs to find where Harry's infection is coming from, and fast. Delivery driver Ian is sitting patiently in minors after an incident at work involving one of his parcels. Emergency nurse practitioner Joe is ready to see him.
Come on in. What's happened to you today?
There's some dust on top of one of the boxes. It's gone actually into my eyes. And it's just gradually gone sore. There's grit or something in my eyes.
Yeah, like just gritty. We'll have a look in your eye. There is a possibility that there is something in, but I think it's probably more like a reaction to something. So we're going to put some drops in first of all. This is orange, so when you're looking, it might look a bit yellow or orange. And it will stain your face, so you'll look a bit like Homer Simpson. there might be a little scratch or a little burn on the top corner of it. And then just have a look in this one. This one's a bit worse, isn't it? So there's one on that one as well. I'm just gonna check the pH. It's only putting a bit of paper in your eye. And close your eye. So the normal pH should be 7. And yours, that's going green straight away, so it's already between 8 and 9, that. It might feel a bit better if we irrigate your eyes. What we do is we just put like a litre of saline into your eyes. Yeah. It's a strange sensation because we put like a little contact lens that stays in your eye, like having an infusion, you know, a drip that goes into an arm, into your eye, and it'll just wash it all out. So it is just salty water. What I want you to do...
Open the eyelid.
I'm just going to pop this in here. You need to keep your eye closed now, and I want you to just hold it there. Swing round, swing this chair round. You need to put your head over this sink, but open your eye so you don't headbutt this tap.
Yeah.
Right?
Ian needs the saline solution to work and bring his pH levels down. The longer it takes, the more he's at risk of permanent damage to his eyes. Back in Rhesus, Harry has suspected sepsis. By his side is worried mum Rebecca. Dr. Duffy is trying to get to the bottom of where his infection might be coming from.
Tell me a bit more about this back pain then.
It's like a cushion pain
Okay.
in the bottom middle of my back.
He has a rare genetic condition called partial sacral agenesis, in which the lower part of the spine can be undeveloped or missing.
Just tell me a bit about your past medical history.
When I was 9, I was diagnosed with it, and then I was catheterised. And I've been catheterised ever since then, and then last year I was quite poorly and I collapsed at home.
Okay.
I went into the A&E and they said I had sepsis. They had to put me in an induced coma for 3 months.
Okay.
And then since then I've sort of been okay. I'm also being investigated for kidney stones on my catheter.
Okay. We'll get some bloods and things sent off and then see where we're at.
Dr. Duffy starts to take another blood test, which should help locate the infection.
Okay, pop your arm nice and straight for me.
But Harry is deteriorating.
Really dizzy.
If I pop those in there, are you okay to check his blood pressure?
With no time to spare, Dr. Duffy calls consultant Dr. Asim Salim for help.
I need a bit of a hand with this young guy in Rhesus. He's very hypertensive. Just put some fluid up.
Why is he hypertensive?
Septic. Lactate's 5.5.
Okay.
So I think we could do with another cannula.
Harry's blood pressure is dropping dangerously low. Sepsis could be shutting down his organs. The ambulances are flooding into Casualty.
Where is this one that's going up to 20?
Sister Jane is struggling with a shortage of nurses after some have called in sick. And Barnsley has well and truly woken up.
We're short staffed, like really short staffed. There's only 9, so we're 3 down. Admissions are piling up.
While Sister Jane deals with a demanding department, back in Rhesus, Dr. Salim and Dr. Duffy are treating patient Harry, who has suspected sepsis. Harry has a rare condition and has been in and out of hospital his whole life.
Back in January, the bowel had gone gangrene, he ended up with sepsis. He was home from January to March.
Okay. Okay. Do you have any belly pain now?
No.
So Rhesus can be sometimes a daunting place to work. Usually the patients are very unwell and they might have multiple different problems that you've got to monitor and treat all at the same time.
With no clear sign of where Harry's infection is coming from, the team hope the blood test results can shed some light.
So hang on, let's see. There you go. He's got an AKI.
I think it's an obstructing stone.
Yeah, so we need a scan without a control.
Dr. Duffy now has more of an idea of what's causing Harry's infection.
Hi, Harry. So we've got your blood results back. They essentially show that you've got some damage to your kidneys, or one of your kidneys. So you've got an AKI, which means that they're not working as fast as they normally would.
That really my stones.
Quite possibly. So it could be that one of your stones, whereas before they've maybe not been causing too much of an issue, it might be that one of them has become wedged in the tube,
Right.
and then your urine can't get out, so it's causing a bit of a, you know, kind of like a build-up of urine behind the stone. Sometimes when that happens and the stones get stuck in the tubes, they can become infected as well. So it could be that that's where the infection is coming from as well. We're going to get you around for a scan, have a look at your kidneys.
How dangerous could this be?
It can depend on how big the stone is. Sometimes they can get a bit stuck and they dislodge by themselves. Sometimes if they're a bit bigger, you know, you will need to have an operation to get rid of them.
So anything you need to do as long as I die.
You're in the best place.
Harry's not out of danger yet.
It has been really hard as a family. We've just all had to come together and do what we can. Last year, he nearly died as well, so it's an ongoing battle. He's come through so much. There was a time where we didn't think we'd get him back. He's proved everybody wrong.
With a hopeful diagnosis around the corner, Harry has his CT scan. Another person who's hoping for answers soon is Mum Megan, who's coming to Casualty with her 5-year-old son Isaac after an incident at playtime.
So Isaac's got a stone in his ear that he's putting at school and we can't find it, can we? You've done it before, haven't you? We managed to get the last ones out, but we can't find these ones.
Mum is very keen to get this sorted out as quickly as possible.
We're flying to Turkey on Monday, so I'm just worried that if there's anything that pressure on his ear would cause some pain, so best to get it checked. We're definitely ready for a break, so I'd not be happy if it put a stop to that.
Hello, Isaac. My name's Greg. I'm one of the nurses. Do you want to come with me? Come on, buddy.
Nurse Greg will give Isaac the once-over.
Right, Isaac. Have you got something in your ear? You messing
did you
around?
get
Did you
there?
put something in your ear?
Somebody told me to.
Someone told you to do it and you did it? Okay. Was it one of your friends?
No.
It was.
Did it happen today, Mum?
No, it happened on Friday, but Dad had a look and we couldn't find anything, so... But he's still saying it's in there, so I thought we'd best get it checked.
Can I have a little look? Is that all right? I'm just going to shine a light in your ear. I'm just going to come behind you. Which one's it in? This one. Do you want to sit down and look at that window there?
Get comfy.
Oh, yeah, I can see it. We can either hook it out. I think we won't be able to grab onto it, so we'll have to get behind it and hook it.
Okay.
Or we can use a little bit of suction, sort of grab onto it and pull it out, all right? What we'll do, we'll pop you in the waiting area, wait for a doctor to come. Yeah, can you give me a fist bump?
What you say?
Isaac works off some of his spare energy while he waits to find out what he has in his ear and whether the family will be able to fly out to Turkey next week.
Ian, do you think you'll tolerate a second one?
Easy.
Right, good.
Back in Miners, emergency nurse practitioner Joe is flushing out dirt from delivery driver Ian's eyes after an incident at work has left them sore and irritated.
Some people you can't get near them, like with their eyes. They don't like their eyes being touched. On the whole, I think Bowser people are pretty strong people and can suffer pain better than some other areas. So both over there, and they're both going fine. You're going to be drenched, aren't you? So I think they're going to take about half an hour at least to go through. At the moment, we've put a litre up in each eye. Sometimes you need more than that. It can be 3, 4, 5 litres, so it can be a few hours of treatment, really.
It's soothing, actually. It's, you know, just like the coldness of it.
Obviously, you're going to end up with a stiff neck and uncomfortable, but he's kind of putting up with it and he's not moaning at all. Ian, how you doing?
Dripping.
Dripping. Are you all right? You're getting a bit fed up with it. I have spoken to the eye doctor.
Yeah.
And told them exactly what's happened today. They want us to keep going with this fluid until your pH is normal. We'll retest and see if it's come down at all. It didn't go green straight away. He doesn't always come down, but it's worth trying a couple of litres because it might do. But again, just shout if you need anything, but I'll keep coming back and checking.
Another half hour. I didn't expect litres of water in my eyes.
Are you all right? Well done for tolerating that.
Tolerating it.
You've done a good job. Let's try again then. I don't know if your eyes look puffier.
They feel a bit puffier.
Probably been absorbing all that water. It's better.
Yeah.
Yeah, it's much better. When people arrive, they are at their most vulnerable, and what we want to do is use our knowledge and skills to make them better. We are privileged to be part of that. All right.
Right, thank you.
You're very welcome. Sorry you're all wet and whatnot.
Ian was referred to the eye doctors. They've now given him the all clear, and he's out on the road once again. Back in the hub, Sister Jane is 4 hours into her shift, and she's 3 nurses light. And even the ones who are in are rushed off their feet.
Where's all nurses? Where's Elmia? Where's Nick? Beth, have you seen Enya? Where's my other nurses? It can be frustrating when you can't find somebody, but generally there is a reason for that. And when the department is busy, and as busy as we can be, you know, you just have to accept it. Has anybody any idea what is happening within this department?
I don't.
In resus, Dr. Duffy has confirmation that patient Harry has kidney stones. But there's another problem.
How are you feeling? You're shaking a bit, aren't you?
Yeah, my chest feels a little bit tight.
Okay. Harry's blood pressure keeps dropping quite low, despite the fact that he's having quite a bit of fluid. He probably was quite dehydrated, so we probably need to kind of catch up on his fluid and give him quite a lot. But just because his blood pressure keeps going so low, we're just going to get the intensive care doctors to come and review him.
Harry can't be transferred to another hospital to treat his kidney stones until he's showing signs of improvement.
Harry, I'm just going to take another little blood test, is that all right? It's just to recheck one of the markers. It's called a lactate, so it's like a marker of infection. So that was quite high. Normally it comes down when the infection gets better and when you have lots of fluid.
What if it doesn't do what you anticipate?
So if it doesn't, I think it potentially means that the antibiotics we've given perhaps haven't worked, so it might be a case of stronger antibiotics. The biggest problem we've got at the moment is that your blood pressure's not really picking up. Obviously, if you're alert, that's a good sign, but you have had quite a lot of fluid and it's not really done what we'd want it to with your blood pressure. It can be really hard for patients' relatives when the patients are really unwell and they're here seeing their relatives poorly. So I think it's really important that we explain to the relatives as well as the patient what's going on, so they're kind of in the loop with the treatment and the plan. Potentially probably need to take you to ITU to give you some more drugs to bring your blood pressure up.
After being seen by a doctor, Harry was taken up to the intensive care unit. He's now home and due to have an operation to remove his kidney stones soon. Sister Jane is still battling a busy department.
Right, so how many are moving up from blue? Because I'm going to lose the will to live here.
But the emergencies just aren't letting up today. Being blue lighted in is an 89-year-old with a complex medical history who keeps collapsing. Paramedic Paul does the handover.
This morning, 8:30, acute onset of breathlessness at rest, dizziness, and left-sided chest pain.
Yeah.
So he's made his way down to his own doctors, just to try and see him with no appointment. They said there's nothing there. Whilst waiting, the chest pain came back, and this is what they've said when 999. Past medical history, he has got type 2 diabetes and chronic arthritis.
Yeah.
Dr. Alex Webster will be in charge of Eric's care today.
Hello, is it Eric?
That's me.
Hello, Eric. I'm Alex, I'm one of the doctors.
Good lad.
How are you, sir?
I'm okay, thank you.
What are you doing here, then?
I mean, I'm okay now.
What happened?
I don't know why, but I can be sat watching telly, and I just realise I've stopped breathing, I'm gasping.
Yeah.
I pass out.
You pass out?
Yes. If I have to be standing, I just fall down on the floor.
Okay.
I just can't understand why I do it.
Have you ever collapsed?
Yes, quite a few times.
Do you lose consciousness when you collapse?
I have lost consciousness, but only for a short time. You see, I'm breathing shallow now, but I'm breathing.
Yeah.
That's the main thing.
And you live with your wife?
Yeah.
And is your wife in good health?
No, she's had 2 strokes, one at the front and one at the back.
Oh, bless her.
At Christmas.
So do you look after her?
I look after her and she looks after me.
So, I'm going to examine you now, if that's okay. Okay, and have a sit forward for me, Eric. I'm just going to lift this up at the back, if that's okay.
Oh, no problem.
Dr. Webster needs to work out if Eric's breathing problems are to do with his lungs.
Right, Eric, give me some nice big deep breaths.
Or if the symptoms are pointing towards a potential heart attack.
Right, Eric.
Yeah.
Let's do a chest x-ray as well. And we'll do a blood test, looking for damage to your heart. And then once everything's back later on, I can come and have a chat to you about what we do next.
But Eric is more concerned about getting back home.
How much later on?
Oh, probably tomorrow. No, I'm joking. It'll be an hour or so.
You've set me out.
It'll be an hour or so. All right, when everything's back. Yeah. All right?
Yeah.
Good stuff. Right, sir. I'll see you later.
I hope so.
Eric now faces an anxious wait to find out how serious his condition is.
Well, I want to get back to my wife. I don't like leaving her on the road.
The emergency patients keep rolling into Barnsley Casualty today.
I think we're just struggling a bit over here.
Sister Jane has been 3 nurses light since her shift started.
The staffing is exactly the same as what it was at 7 o'clock this morning. Nobody's come in. There hasn't miraculously one groan from the money tree. We're still without staff. We're still on 9 nurses. It's very hard work.
But there's more bad news to come.
One in Resus that I've just moved in. So that takes another nurse away. So we're a little stretched, to say the least.
With another nurse down, Sister Jane just needs to keep going.
Do you know where Adam is? I just need a patient taken from Resus. Anybody seen Adam? God, give me strength. I do feel under pressure, and you'll answer the phone and go, "Hello, it's Jane," but you're just paddling for your life and trying not to drown in it all, because it can be hectic. I will as soon as I've done this one for this trauma that's in Resus.
As Sister Jane battles on, over in the paediatric waiting room is Mum Megan and a very energetic Isaac.
Isaac. He's very, very boisterous. Never sits still, never stops talking. He's always up to mischief. Bit of a dancer, aren't you, Isaac? Yeah. He likes playing outside with everything outside in his construction. Obviously likes playing with stones.
The schoolboy pushed a stone in his ear, where it's been stuck for the last 3 days.
That's my rocket.
But Megan is desperate to get this cleared up before their holiday next week. She's pinning her hopes on Dr. Chris Yeoman.
Hello, Isaac. You coming in? Yeah. So what have you done?
Somebody told me to put a stone in my ear.
Right. And what happened next?
I did it.
You did it. And how big was this stone?
Like that big.
Isaac, I need to have a little look in that ear. Is that all right? Yeah? Are you going to be a good lad and let me have a look? Just going to pull your ear a bit further, OK? Well done. So I think that looks OK. It looks like you probably have had something in there, 'cause it's a little bit red. Do you see anything, Greg?
It's like a grey object, yeah. Do you see something this morning as well?
I've not seen it, no.
Do you want to hold
it's
your
all
mum's
because he
hand so I can
said.
have more of a look?
Yeah.
All right, well done. Well done. I can't see anything in there, to be honest. These only go a certain distance in, obviously. OK, and I'm a bit reluctant to get it right in. What I might do is have a quick chat with our ENT team, so our ear doctors, because they've got a slightly different kit that they can look a little bit deeper in. OK, I'll go and give them a call and just see what they say.
Isaac and his mum head over to Dr. Rob Telford in ENT.
I can't see anything in the ear at the moment. Do you feel like it's still in there?
Yeah.
Yeah. There's a small bit of skin, but I don't think is a pebble. Let's have a... So if you stay really still for me. You're doing really well. Stay... Oh, well done. So there isn't anything in there, which is good. There's a little bits of dead flaky skin. There's no pebble in there, nothing that we need to get out. Can I have a look in your other ear? Where are you going on holiday?
Turkey.
Turkey? Oh, wow. Have you got your swim shorts ready?
Yeah.
Yeah. So can you look away from me again? This one's all fine as well. You've not been putting anything in. So you can go on your holiday and know that you've not got a rock in your ear. Are you going to the beach in Turkey? Yeah? So don't put any sand in your ears, because otherwise you'll have to come back.
Thank you.
That's all right.
Meanwhile, eagle-eyed nurse Greg is doing his own investigations, and he thinks he's spotted a clue.
So, because he was jumping around in the waiting area, I went to have a look, and I think I found what suspiciously looks like was in his ear. I know all rocks look the same, but potentially it could have been what's in his ear. So, yeah, and it is small enough that it would have got stuck in his ear, and it could have come out.
Well, I'm glad there's nothing in and that we can go on holiday and that we're all clear, aren't we? And you'll not put anything else in your ear ever again, will you? No. That were a fun day.
Isaac had a great holiday in Turkey and managed to resist the temptation to stick sand in his ear for the whole time he was there.
Where have you been? I've been trying to ring you.
Over in cubicle 3, Eric is being treated for a potential heart attack.
Eric, is she at home?
Yes, she's okay.
Perfect, all right.
She was in the kitchen, lad.
But he's more concerned about his unwell wife at home.
I'm going now then, Pauline. I'll see you when I'll get a bell.
I'll keep her updated, Eric.
Thank you, Will.
All right, sweetheart.
Dr. Webster has ordered some bloods to be done.
Hey up, Eric.
Hey, Will.
Can I do a quick ECG, darling?
And now Nurse Amy is getting a trace on his heart rate.
It takes that long to set up and all of 10 seconds to print it out.
Having a good bedside manner is pretty much everything about being a nurse. It's nice to build a relationship with them.
We're okay.
I'll get to the doctor.
If I can tell that my patient is down to earth, Barnsley, local, and they're using a bit of slang, then I'll relax and my slang words will come out and we'll have a bit of a laugh because they'll go, oh, look, it's a Barnsley lass. And it's nice to have that bit of common ground.
You'll not be too long round at X-ray anyway, so I'll get you straight back round, OK?
Sorry.
Heart trace complete, the doctor now needs a chest X-ray to give him the all-round picture of why Eric keeps fainting.
The concern is that this could be his heart that's making him collapse, but there's also lots of other contributing factors.
Well, if I can get them brakes off. How are you on your feet?
Not too bad.
You'll be able to stand up for your X-ray?
Yeah.
Good man, right.
I think once we've done our baseline investigations that we can do in A&E, so the basics, chest X-ray, bloods and stuff.
Nice deep breath in for me. Lovely, you can breathe normally.
Is to try and catch any obvious sort of cardiac abnormalities.
Nice and easy, that one's it.
No problem.
Good man. You lift your feet up again for us. There we are.
Dr. Webster will have to balance his findings with the knowledge that Eric is desperate to get back to his unwell wife as soon as possible.
If they're all right, then I think what would be the safest thing would be to let our medical colleagues look after him on SDEC, which he doesn't necessarily need to come into hospital, and he can be investigated as an outpatient.
But until the doctor knows it's safe, Eric is going nowhere. Back in the hub, Sister Jane is also wishing it was home time.
There's nearly 100 patients in the department. I'm working on 8 nurses. I've got no cubicles and no staff, so she's coming up to the ward.
But over the years, she's become an expert at juggling the chaos of a busy department and rolling up her sleeves.
Well, I'm a very busy member of the team. I always do things myself. I'm a worker, not a shirker. I started off nursing when I was 19 years old. It was never my goal to be anything other than to nurse. What do you want?
Whiskey.
I wish. I'll join you. You've had a cracking life, you. With all men you've had. When I came to Barnsley, I was asked by my manager if I wanted to apply to become a sister. And was fortunate enough to get the role, and I love the role that I do now. Are you putting a ring on it?
Absolutely not.
I know. All right, sweetheart. So lovely to see you. I think my strongest quality is that I try to be fair to everybody. At least you will have given them a night's stay where they can try and get you sorted. Do we agree? All right. And work alongside them. How are you? Have you got cold? Are you all right, my lover? It's taken a lot of hard work to get to where I am. For all that you did. And all that you do.
You're welcome. Thank you again, on behalf of us all.
It's what we do. I think sometimes when you work hard, you get your rewards, and this is mine.
I love you. I love you.
Dr. Duffy is out of resus and now in the assessment hub.
I think the main reason that I enjoy working in A&E is that you never know what's going to come through the door. You do get a lot of variety.
Her next patient is waiting in cubicle 4. 38-year-old Nicola has had backache for weeks, but after a scary episode of blurred vision, she decided to come into Casualty.
Hiya, I'm Alice. So, tell me what's brought you into hospital today?
I've got really severe back pain and it's radiating down my right arm.
Okay.
Today, driving kids back home, my vision went blurry.
Okay. Was the pain particularly bad at that point, or...?
No, it was just blurred vision, yeah.
Okay.
It's just driving kids back home.
Yeah, and how long did that last for?
Good 20 minutes.
Okay.
I've got an headache now and I don't really suffer with migraines. It's not something that I didn't get to sleep till 3 this morning.
Yeah.
It was just unbearable.
Okay.
Do you know when you just generally don't
feel yourself?
Don't feel myself.
So Sometimes it's really hard when people come in with lots of different symptoms because you've got to pick out what the emergencies could be and ensure that you focus on those first and foremost. Are you all right just to pop your jacket off for me? I'll pop some gloves on. I'm just going to start by having a listen to your chest, all right? So if you just take some deep breaths in and out for me. Stand up for me and just show me whereabouts in your back you're getting this pain. Let me know if it's painful when I'm pressing.
Yeah, that hurts.
That's painful when I'm pressing there. Okay. I'm just going to have a press down your spine.
Yeah, just there.
Okay, so a bit tender. Okay. It's a bit of a funny one because you've got lots of different symptoms, and obviously the aches and the pains in lots of different places does perhaps fit with it being a virus, but probably need to get you for a chest x-ray today. But I think what's concerning me most is this headache that you've had, especially with you saying it kind of came on you quite suddenly. I think we need to get you around for a CT scan of your head. Are you happy with that?
Yeah. Just want some light shedding on it. It's just not very nice, is it? Do you know when you feel poorly and you're
not really getting any answers.
Stopping me from functioning.
Yeah.
I've got 3 kids, I need to function.
Yeah.
Nicola heads down for a CT scan to try and solve the mystery of her sudden symptoms.
We just need to concentrate on getting people out.
There are close to 100 patients in the department, and Sister Jane has been struggling with a nurse shortage all shift.
It's the most difficult time.
With the team under pressure, she tries to keep their spirits up.
What's the matter, Alex? Come on.
A man that lays mats.
It's the old ones.
It's the old ones at best.
There is a great deal of humour within the team. We can have humour at the worst times of the day, but that's just that's our coping mechanism, really. I mean, you'd run a very good Punch and Judy show, you.
While Sister Jane keeps the team going, heading to radiology is Nicola, who came into Casualty with a mixture of symptoms.
Hi, doctor sent me down for a chest x-ray. Yeah. It's my back that hurts, but she sent me for a chest x-ray.
Now you've got your chest flat against this floor.
Dr. Duffy ordered a number of tests to try and get to the bottom of her problems.
Breathe in.
So we've sent her for a chest x-ray. We just need to make sure that there's no kind of pathology on her lung that might be explaining the pain she's getting in her back.
But Dr. Duffy is most concerned about the severe headaches Nicola has started to experience in the last few days.
We'd want to do a CT scan of her head just to rule out that she's not got a bleed on the brain.
I've just generally felt unwell. It's not right. Best place to be if you feel poorly, isn't it? But yeah, hopefully I can shed some light on it.
Back in the hub, Dr. Duffy gets the test results.
The CT scan that we did of your head was absolutely fine. I'm happy that the CT scan was normal.
Okay.
You've not had a bleed that's been causing the headaches. The chest x-ray was clear. There's no kind of pneumonia or infection on there today, so I'm happy with that. But I think the pain that you're describing kind of in your back and your shoulder is likely muscular pain. It's hard to know whether this is all one thing that's all connected or whether it's lots of different things. But I'm happy that we've ruled out all the serious things today.
All right, well, thank you.
All right. It can be frustrating sometimes when you can't get to the bottom of something. It can be frustrating for me and it can be frustrating to the patient because people want to come in and be told a diagnosis before they get admitted or sent home. But that is unfortunately not always possible.
The Casualty team haven't found an underlying cause for Nicola's condition, but they have been able to offer some reassurance.
Yeah, it's given me peace of mind that they've done a CT scan and ruled out anything too serious. So, yeah, it's put my mind at ease.
Nicola is now having physiotherapy treatment and hopes to feel back to herself soon. In the hub, Dr. Webster has the first batch of results back for 89-year-old Eric, who keeps fainting.
So his blood tests are fine. I just need to find out if he's had his chest X-ray, and if that's normal, then we can get him home hopefully, and get him the follow-up he needs.
Eric is keen to get back to his unwell wife as soon as possible, but in the meantime, he's enjoying a bit of Barnsley Casualty hospitality.
Chicken meal.
That cup of tea and that biscuit can make all the difference. They'll calm down, they'll relax, and they'll feel a bit more at ease.
Eric's X-ray is now back.
There's lots and lots of things that can cause chest pain, but basically, looking at this, it's quite reassuring, to be honest.
And so too is his ECG.
So he's got quite a common finding in elderly people. So he's got what we call first-degree heart block, which is basically where the conduction from one part of the heart to the other isn't quite working properly. It's quite common. It doesn't usually cause people problems, but in the context of him collapsing, his history doesn't seem to fit one diagnosis.
Dr. Webster wants to discharge Eric into the care of the outpatient team.
So his ECG shows first-degree AV block.
But with the results inconclusive, he needs to check with consultant Dr. Dave Walker.
I was wondering, would it be reasonable to, if everything comes back normal, refer him to medical aesthetics?
Yeah, no, definitely.
Awesome, thank you. So we're going to tell him the good news. So your X-ray is fine.
Yeah.
Your bloods are fine. Your ECG, so the tracing of your heart, that just shows a little abnormality that it's a little bit slow and there's a bit of a rhythm disturbance on it, okay? So I don't think you need to come into hospital, but I do think we need to refer you on to our medical colleagues who can have a closer look at you. All right, so I'm gonna have a chat to them now and see if they'll see you today. If not, I'll get you a date.
So
it's nice
today then?
Hopefully, yeah.
Thank you.
More good news for Eric.
Yeah, is that all right? Brilliant. Cool, thank you, bye.
Dr. Webster has got a same-day referral to the outpatient team.
And they can then follow that upwards with a longer ECG, probably over 24, 72 hours.
Right, Eric, we're going to get in a wheelchair. We're taking you down to SDEC, which is same-day emergency care. Okay, well, you'll be seen by their doctors, probably a bit quicker than on here as well. So Grant's got a wheelchair for you.
Is there any chance of getting home then?
I'm sure there will be, because they don't have beds on there to sleep overnight, so that's the good news.
Brilliant.
You'll be able to get home to Pauline, that's it.
Eric was able to get back to his wife that day.
Bye.
But is still under the care of the outpatient team. The cause of his fainting remains unknown. After an exhausting 10 hours on her feet, Sister Jane's shift is finally coming to an end.
What time is it? I'm going. I'm going.
And even though she couldn't get nurse numbers up, she's managed to get patient numbers down.
85 patients in the department, 3-hour doctor wait, no beds. But they are full to capacity with nurses, so they have more than us. Right, and on that I'm going to hand over.
But this is the last shift Sister Jane will be having for a while.
I'm going off for 6 weeks for an operation on my toes. See you later, Drew. Thank you. I think it'll be weird for me being on the other side of the fence, but I think it'll be difficult for the people who are going to be dealing with me as well. So I don't know who I feel more sorry for.
Sister Jane's operation was successful. She's now at home recovering, and turns out she was a good patient after all.
What festive new arrival is Cannon Hall welcoming this week? Join all the gang for Christmas on the Farm, brand new at 9 tomorrow. And is this the season that Jack and Kate finally get together. Catch the Good Ship Murder Christmas special, brand new Wednesday at 9. Next, motorway cops catching Britain's speeders.